Adverse childhood experiences, also known as ACEs, are a really prominent part of healthcare and public health in today's world. Professionals are becoming more and more educated on what they are, why they matter, and how we can address some of the negative outcomes that they may induce. So, what is an adverse childhood experience? This is when a person experiences one or more of many difficult or traumatic events before the age of 18. This could be harm from an adult in the household in the form of physical, emotional, or sexual abuse, not getting their needs met through physical or emotional neglect, or other household complications such as living with someone with mental illness, witnessing abuse against their mother or father, their parents getting a divorce, a relative in the household going to prison, or someone in the household abusing drugs or alcohol. These problems are really prevalent in our society, with approximately 61% of adults having had at least one ACE and 16% having had four or more ACEs. So, why are adverse childhood experiences important? Studies show that ACEs can be a risk factor for serious health conditions and behaviors such as depression, substance abuse, obesity, and even less obvious concerns such as cancer and chronic obstructive pulmonary disease. Specifically, people who have four or more ACEs are at the greatest risk of developing these health concerns throughout their lifetime. The presence of ACEs can also predict the likelihood of someone getting an education and experiencing socioeconomic challenges. People with a high ACE score often have had changes to how their bodies and minds respond to stress because of the high levels of trauma that they experienced while their brains were still developing. It is important that healthcare workers can be aware of people with high ACE scores or who are at risk of having a high ACE score so that they can address their patients' mental and physical health care in the best way possible. So, what can we do about adverse childhood experiences? One major aspect of ACEs is simply becoming aware of when someone has had a high ACE score and helping them find resources such as therapy and other professional support that will help them to retrain their minds and bodies to more effectively handle stress and health concerns. This may look like an attentive healthcare provider that directs the patient to mental health resources when they notice that the patient shows signs of having a history of trauma. Additionally, studies indicate that people with a high ACE score are less likely to experience the negative health outcomes associated with ACEs if they had other positive experiences that balanced things out. So, although a child's home life may be rocky, outside stable adults and positive experiences can serve as support for them and help them to build resilience against their ACEs. As we further our understanding of people in the healthcare world, it is super important that we keep their past in mind and help them protect against and overcome these challenges.